I am Dr. Sharjeel and you are watching my YouTube channel. Today was a very tiring day. I had to perform a lot of surgeries, but this case was worth recording and mentioning. Now I am showing you this case of 25 years old male patient who had a hammer chisel injury 2 months back. Now he was seen by many doctors and was given topical and intravitreal antibiotics, topical and systemic antifungals. He was treated for intraocular foreign body. B scan was done and it was inconclusive. Then he was treated for bacterial keratitis, fungal keratitis, traumatic endophthalmitis. So he was referred to Islamabad and Lahore to their facilities, and they again performed B scans but couldn't find any foreign body in the vitreous and retina. Patient vision was gradually deteriorating. Then someone referred him to me, and I'm showing you this case so that we can learn something from it. When I examined him, as you can see that there is a central corneal scar, pupil is obscured, a yellowish appearance in the center of the pupil, vision was faulty PR. There was a corneal scar, something in the anterior chamber hidden in the pupil with a yellowish rust. AC was extremely shallow. There was iridocorneal touch at multiple points. So I told the guardians that vision is extremely decreased, and with a poor prognosis, there are less chances of improvement. But I would like to make the globe, make the anterior chamber, and we should remove the thing which is obscuring the pupil. In this way we may be able to save the globe. So they readily agreed, and I myself performed first B scan, and again retina was flat and vitreous was quiet, which was unusual. Now right eye iris color was different from the left. So when I decided to explore under local anesthesia 2.5 ml, and then I made a port with 11 number knife, put viscoelastic, and then as soon as I put the IA cannula and cleared that hypopion like thing, there I found this metallic foreign body which was stuck in the pupil. So here when I touched it with the cannula, I asked assistant to make video of this step. I enlarged the port, removed it. As you can see, the corneal wound through which it entered, it was self-sealed. So whenever you are not finding with intraocular foreign body after hammer chisel injury in the vitreous and retina, it can lodge anywhere in the eye, mostly in vitreous and retina or even orbit, but I have seen patients with metallic foreign bodies in iris, stuck in the iris, cornea, lens, ciliary body as well. So I applied 2 sutures to close the paracentesis. Now that foreign body caused sidrosis. It rust was adherent. You can here see to the iris all around. I tried to remove a little bit, but then there was bleeding, so I stopped. Now the take home message is, if someone tried to explore it earlier, this patient vision would have been salvaged and sidrosis would have been avoided. And if you couldn't find intraocular foreign body in vitreous and retina and anterior chamber details are hazy, you should either perform UBM or anterior segment OCT to look for foreign body or explore it. So let's hope that this young patient gains some vision in this eye. And let's talk about sidrosis. Sidrosis bulbi is a condition due to metallic intraocular foreign bodies. Metals with a low redox potential, ferrous and cuprous, are more toxic than ferric and cupric. Sidrosis develop within weeks. It affects virtually all structures of the eye like cornea, iris, lens, trabecular meshwork, retinal pigment epithelium, internal limiting membrane, and optic nerve. Now, symptoms are loss of accommodation, iris heterochromia, night blindness, decrease of vision, decrease of visual fields. And the definitive treatment is to remove the intraocular foreign body as early as possible. ERG and EOG are used to monitor the ocular recovery after metallic foreign body is removed. So let's see, we will follow this patient that whether his vision improves or not. So that was an interesting case with a take-home message. Thank you very much.